Now, we come to the real trouble. The real trouble is, if glucose level is more than normal, if there is hyperglycemia, why it is dangerous? Apparently, if we have more glucose, our brain should be more happy. Is that right? Apparently, our retina should be happy, and even your or mine germinal epithelium should be super happy. But there is a problem. Moderation is the beauty of life. Anything too much or too less, both is bad. When glucose becomes more than normal, that becomes toxic substance in our body, right? So let me explain first that when glucose becomes more than normal, what happens? Let's come over this side. When glucose becomes too much, for example, glucose is not 140 milligram or 120 milligram, right, per dl. Let's suppose is an unfortunate person in which blood glucose is not being regulated well, and his blood glucose level is, let's suppose, 500 milligrams per dl. For example, there is a person in which blood glucose regulatory mechanisms are not working well, and when this person takes carbohydrate rich meal, his blood glucose level goes too high. If his blood glucose level becomes too high, right, what are the problems? Number one is, all extracellular fluid will become hyperosmotic. What will happen? That your extracellular fluid will become, yes, hyperosmotic. Right, now here are the cells, right, and in between here is glucose and extracellular fluid. If there is too much glucose and it is hyperosmotic, it will suck the fluid out of the cells and many tissues will dysfunction and you will feel fatigued. Again, I am repeating, if blood glucose level really goes too much high, generally what happens in the body, generally speaking, that this hyperosmotic extracellular fluid, is that right, that will suck the water out of cells, and cells become somewhat dehydrated, and these dehydrated cells don't perform optimally. So this is one problem which occurs due to hyperglycemia all over the body, in all tissues. Is that right? Second is we should see the effects of hyperglycemia, especially on the kidney. What happens in the kidney? Let's suppose here is your very beautiful, what is it? Kidney, and of course you have two kidneys, and every kidney you have about 1.2 million nephrons. As I mentioned in every lecture I mentioned, you are millionaire as far as nephrons are concerned, but unfortunately they don't produce dollars, they just produce urine, right? So you have millions of nephrons. Now in every kidney you have 1.2 million nephrons. Now let me see that how nephrons malfunction. Their function is disturbed when there is too much glucose in the blood, right? Let's suppose here is one nephron, and this nephron I draw out, I bring it out, and we see what happens there. This is Bowman's capsule, proximal convoluted tubule. Here is loop of Henle, descending part, then ascending part, then distal ascending part, and then there is distal convoluted tubule and collecting tubules, and many collecting tubules come together and eventually they make collecting ducts, and here is your urine drop. Urine is being produced, right? Now when your blood glucose level is very high, when your blood glucose level is very, very high, then what will happen? That blood vessels, afferent arterioles will bring more glucose to the capillaries of glomeruli, right? And normally what happens? Glucose is freely permeable. Glucose is freely permeable. So in normal healthy person, glucose filters from the glomeruli into the nephron, and in normal person, most of this glucose is reabsorbed from here back to the blood. There are special mechanisms in proximal convoluted tubules, right? And there are many mechanisms. One of them is sodium glucose co-linked, sodium glucose linked transporters. They take glucose from here, right? And they will take within the cell, and in the cell basolateral side, this is the apical side of the membrane which is facing to the lumen, and this is the basolateral side of the membrane, right? Now these special type of glucose transporters are present only on apical side of the membrane, and then there are special channels, right? These are called glucose transporters type 2. They are present on basolateral side. So whatever glucose enters, it will through this pass out, right, back to the blood. So practically, if your glucose is within normal range, now listen carefully, practically if your blood glucose level is within normal range, then most of the glucose which is filtered, which we call it filtered load of glucose, most of it is reabsorbed, most of it is recaptured, it is reclaimed by the proximal convoluted tubular cells back to the blood, right? So you can say, if you are somehow having some special type of tongue, you can taste, here it is sweet, but as you go forward, sweetness becomes less because most of the glucose is gone back to the blood. And normally we don't allow any significant amount of glucose to be lost into urine in most of the people. Am I clear? Now, if your blood glucose level goes pathologically high, if blood glucose level goes very high, right, then what happens? If there is more glucose in the blood, as I told you 500 milligram per dl, then filtered amount of glucose will be more. We say there will be very heavy filtered load of glucose, and all these reabsorption mechanisms will be overwhelmed. They will be overwhelmed. They will be not able to reabsorb all of the glucose. And if there is too much glucose coming here, then some of more glucose comes, more absorbed, more glucose comes, more reabsorbed. But at a level when glucose goes beyond the normal range, so much glucose arrives here that some of it cannot be reabsorbed and glucose start, yes, some of the glucose was not recaptured or reclaimed or reabsorbed. So this glucose will pass to the more distal part of, what is this? Nephron, and this glucose will appear into urine. This glucose will appear into urine. So what will happen? Like glucosuria or glucosuria will start. But this is not the only problem. Of course, this is one problem, that when blood glucose level goes very high, not only all extracellular fluid in the body become what? Hyperosmotic, and pulls the water out of the most of the cells of the most of the tissues, and cells under a dehydrated condition malfunction. There are not, these are general problem in the body. Special problem comes when a high amount of glucose is being filtered into nephron, and if nephron cannot reabsorb all of it, right, glucose start appearing into urine. Now, when you are losing glucose into urine, actually you are losing a form of energy in the urine. you are losing calories into urine. This is one problem. But it produces another problem, that this glucose which is moving forward, it will drag the water with it. It will pull the water with it. What happens? Most of the glucose is reabsorbed here, and lot of water is also 60 to 70% of the water is also reabsorbed here, right? But if glucose is not being absorbed and it is moving forward, it will pull the water with it. Then more than normal amount of water will be pulled in the lumen along with the glucose due to its osmotic effect, and more water will appear into urine, and then you will pass excessive amount of urine, right? If per day in 24 hours, if your urine amount become more than 3 liter, we say you have started polyuria. Now, it means one problem was that there was glucosuria. Number 2 was that this glucose was pulling lot of what? Water with it. Because it was pulling lot of water with it, so it was also producing some sort of diuresis. What it was producing? Diuresis. Of course, this diuresis is also producing dehydration in the body if you don't control. And if body is getting dehydrated, of course, then your which center? Thirst center in hypothalamus will be activated, and when those thirst center are activated, you will feel more thirsty, and if water is available, you will take more water. We say with polyuria, and with polyuria you have polydipsia, and if lot of calories are being lost, you will lose the weight, and even weight loss can occur, and you will feel more hungry due to loss of calories, and there may be polyphagia. Is that right? So multiple problems are occurring there. That number 1, normal blood glucose is very high, hyperglycemia. The glucose filtered into nephron is too high, right? Then this high load of glucose cannot be reabsorbed by the proximal convoluted tubules because it is more than the capacity of the proximal convoluted tubule to reabsorb. When it becomes more than that, lot of glucose appears into urine, and that produces glycosuria. And this glycosuria, what this glycosuria is doing with this osmotic effect, it drags excessive amount of water with it. It does not allow the nephron to reabsorb the water properly. So flow of water also increases. Flow of water through the tube also increases. When flow of the water increases, we say that there is diuresis, but with this rapid flow of the fluid produces one more problem, and that is a very serious problem. This rapid flow of the fluid through the nephron lumen produces one more problem. Normally what happens? First we compare normal, then we talk abnormal. Normally when there is normal glucose in blood, normal level of glucose is filtered, most of the glucose is reabsorbed, along with that lot of water is reabsorbed, and fluid is moving here slowly or fastly? Slowly. When fluid is moving slowly, then what happens? That cells of the epithelium of what is this? Nephron, in different part of the nephron, right? Those cells are able to, when glucose level is normal, most of the glucose reabsorbs, most of the water reabsorbs, right? Then less water is left normally in the lumen, which is moving very gradually inside the nephron. And when this fluid is moving very gradually, these cells have less time or more time to work on the fluid. More time, because water is flowing slowly. If water is moving slowly, then the processing of luminal fluid becomes more effective by the nephron cells, and electrolytes are properly reabsorbed and excreted. Due to that reason, electrolyte balance is maintained well in the blood. But now imagine abnormality. Person with high glucose level in the blood, high glucose load here, lot of glucose is reabsorbed, but still lot more is going into urine, glycosuria is produced. Then there is osmotic effect of this glucose. So what happened? Lot of water is also going. When glucose followed by water with osmotic effect, when rapidly passing, what will happen? That chances of epithelial cell of nephron to work on fluid and electrolyte are less. Is that right? So due to this rapid flow induced by the osmotic effect of the glucose, epithelial cells are unable to work properly to reabsorb the electrolytes or to secrete certain electrolytes. That will lead to electrolyte imbalance. So not only blood glucose problem is there, not only there is glucosuria, not only there is diuresis, there is electrolyte imbalance. Imbalance is also there. You can just imagine that as if there are a lot of proteins here which are capturing the electrolytes. You imagine those proteins are like monkeys. Those monkeys are capturing what? Electrolytes, right? Water is going and electrolytes are like mangoes. Electrolytes are like mangoes. If water is going, electrolytes mean mangoes are going, and water is going slowly and monkeys are catching the mangoes and enjoying. But if water suddenly becomes very fast, can mangoes be caught? Not. So monkey will try to catch, but due to rapid flow, electrolytes will be dragged very rapidly and appear into urine. So blood electrolyte balance or extracellular electrolyte balance will be disturbed too. Now you understand that very high blood glucose level is not good. Why it is not good? Overall in the body it produces hyperosmotic extracellular fluid, and that sucks the water or pulls the water out of the cells in most tissues, and relatively dehydrated cells don't work optimally. Secondly, we must know when blood glucose level is very high, what are the effects on the kidney? When blood glucose level is high, glucose load on the kidney is high, kidney epithelium cannot reabsorb most of the glucose, glucose appears into urine, glucosuria. That glucose pulls the water with it. What is that? Diuresis or polyuria. When more water is passing through the lumen, it takes faster flow, and this fast flow of the fluid does not allow the epithelial cell to properly recapture certain electrolyte, and electrolyte maintenance in the body is also disturbed, right? Now these are some effect of, unfortunately, some effect of hyperglycemia. These are only some effects. Then there are long-term effects. If the mechanism in your body which controls the blood glucose and maintains it within normal limit, if those mechanisms are disturbed, as it happens in diabetes mellitus, if those mechanisms are disturbed, not only polyuria or polydipsia or polyphagia or electrolyte imbalance occurs, if this type of problem is long term, again I will repeat, if you have a tendency to have hyperglycemia, if you have a tendency to have hyperglycemia chronically for long time, then long-term complications occur. Then long-term complications occur. We have discussed in the previous lecture. That if for, okay, let's come here. Long-term complication can be due to hyperglycemic peaks, long-term complications due to hyperglycemia. What happens? That if hyperglycemia, now I am going to draw a blood vessel here. This is a blood vessel and this is your, what is this? Endothelium. These are your endothelial cells. Now if blood glucose levels become very high, right, they damage. Glucose itself is directly toxic to endothelial cells. Glucose can directly, high level of glucose can directly damage the cells. With every hyperglycemic peak, these cells become dehydrated. Number one. Number two, high level of glucose for long time, for months and years, will react with certain proteins here and produce glycation products. What are glycation products? That there is a certain protein, different proteins here, cellular or extracellular. Glucose react with those proteins, and when glucose react with those proteins, that produces glycated product. We call them, those products are called advanced glycation end products. So in chronic cases where you have a long-term tendency to develop hyperglycemia again and again and again, right? Because glucose hyperglycemia controlling factors in your blood are not working well, and after every meal glucose goes beyond the normal limits, right? There is chronic insult to your endothelium, right? It means now this disease is converting not only hyperosmotic disease, it is converting into vascular disease. Now it is becoming vascular disease because it is damaging the endothelium. When it is damaging the endothelium and basement membrane under the endothelium, and with this age products, right? Advanced glycation end products. These age products, right? They produce lot of damage here. For example, they can produce cytokines. They can force the cells here to produce growth factor. They can force lot of production of this abnormal glycated proteins to which glucose is sticking. They become malfunctional. So they, as I mentioned, that more cytokines are produced here, more growth factors are produced here, more, you can say, reactive oxygen species is produced here, right? More proliferation of the smooth cells and more deposition of the extracellular fluid, you can say collagen and such substances are deposited here which are abnormal, and eventually that may lead to the formation of atheromas. Atherosclerotic disease will come, especially in large vessels. So we say that long-term hyperglycemia may lead to macrovascular complications or diseases, that large and medium-sized vessels, right, they are damaged so much that they develop a lot of atheromatous plaques. And in these diabetic patients, the atheromas or atherosclerotic diseases developing earlier than the normal population, developing more widely, and atheromas are more severe and dangerous and unstable. You are getting it? Again, I'm repeating. Actually, now I'm trying to tell you something else, that chronic damage by the glucose and damage to the endothelium and eventually production of lot of advanced glycation end products convert the whole system into inflammatory disease of the vessels, right? Because there are cytokines, because there are growth factors, because there are infiltration of neutrophils and macrophages and lymphocytes, because there are a lot of proteases released there, because local cells are proliferating too much. So all this lead to a macrovascular disease which appears pathologically as widespread, very aggressive, rapidly developing, right, dangerous atherosclerotic disease. And this atherosclerotic disease clinically manifests in which vessels specially? It produces coronary artery disease, myocardial infarction is more common, of course. You can talk about cerebrovascular disease, right? There are more, what are these? In central nervous system, arteries damage, which may lead to ischemic stroke most commonly, but hemorrhagic can occur. Then atheromas can develop in your limbs, right? Peripheral arteries, peripheral, yes, arteries, atherosclerotic disease, especially ischemia, and this type of ischemia is very common in the lower limb, which added with the neuropathy and infections and vascular disease leading to ischemia may necessitate at some advanced stage, unfortunately, limb amputation. Is that right? Diabetic foot. Then, not only this, one vessel usually students forget. The vessel which is going to the kidney, we call it renovascular disease. Renovascular disease. This renovascular disease is actually renal arteries, not talking about the glomerular disease and other disease related within the kidney, right? So atheromas may develop there, and that may lead to what happen? Reduced blood flow to the kidney. So in this way, high glucose level lead to macrovascular diseases, and in some organ it loves to produce microvascular diseases. As I mentioned in previous lecture, that the target of the microvascular diseases, that again high glucose has damaged the basement membranes, and those basement membrane in certain organs, smaller vessel, certain organ, smaller vessel, basement membranes become very thick but cracky. They develop multiple cracks, they develop multiple pores, they develop multiple, you can say, holes, and those, again, in those organs in which microvasculature is disturbed and microvascular disease occur, you should remember retinopathy, then you can remember, yes, neuropathy, different types of neuropathies, right, which may be autonomic neuropathy or somatic neuropathy. Somatic neuropathy may be motor neuropathy or sensory neuropathy. The sensory neuropathy may be symmetrical or asymmetrical. We will have a full lecture on neuropathies. Diabetic neuropathies are very important. We'll talk in detail, right? So for a while you just believe me that diabetes leads to microvascular neuropathy, right? Small vessels. Then in the kidney, nephropathy, small vessels in the kidney, especially we can talk about vessels in the glomeruli, capillary system, that is damaged by the diabetes. So nephropathy. With this, so what we see, that it is very important to keep the blood glucose level in normal limit. The blood glucose level go beyond the normal limit and above the normal limit, it can produce generalized dehydration in the body, right, and hyperosmotic extracellular fluid. It can lead to the polyuria, and of course then diuresis, and then electrolyte loss and electrolyte imbalance in the blood. Then in the long run, it can produce macrovascular disease, it can produce microvascular disease, and many more complications, right? For example, it can produce cataract, then it can lead to more infections. In the previous lecture, I explained that why hyperglycemia lead to ineffective, you can say, immune system, and how neutrophils and macrophages are drunk with high, what is that? Glucose, and they don't perform well, and I have explained it in the previous lecture, the more infections. So it means that when blood glucose levels are very high, acutely or chronically, that produces lot of dysfunction in our vascular system and other systems. Is it clear? Yes. Now I want to talk about, okay, this is understood clearly that we should not allow the blood glucose level to go beyond a certain limit. It means our body must have very powerful mechanism to prevent hyperglycemia. We will talk about that when we talk about insulin and related substances. We must have very, very powerful mechanism that once we eat the food, after that there is a tendency to reabsorb lot of glucose, and that glucose, if not immediately stored, right, that may produce spike, hyperglycemic spikes, and these repeated hyperglycemic spikes after every food can damage our body. So there are very strong mechanisms to blunt those spikes of glucose, right? We'll talk that in insulin. Now we come to the other question, that why it is so important that blood glucose level should not fall beyond a certain limit. This is also a question. Why we should keep our blood glucose level around 50 to 60 milligram per dl? For example, if my blood glucose level become 40, what's bad in that? Answer is, I have already given, that there are some tissues which mainly depend only on glucose. What were those tissues? Your central nervous system, your retina, and your very, very sacred, what is that? Germinal epithelium, right? And RBCs even love to use glucose preferentially, right? So these are basically glucose using tissue.